my name's Kate Wood, and I'm a physical therapist here at John Getz Physical Therapy. What I wanted to talk about today was foam rolling for posture. Now, as we all know, if we've been sitting for a long time at our desk or just sitting on the couch for a while, we tend to feel a lot of stiffness. Often the stiffness will tend to occur right at that mid-back area. So we call this the thoracic area, so right here. If you see our spine, here's my spine model. These lower vertebrae, this is our lumbar spine, here's the thoracic, and here's the cervical. I want to go over foam rolling for your thoracic spine, this mid-thoracic area. Oftentimes, after sitting for a while, we tend to find ourselves slouched forward a little bit. This part of our spine can get very stiff. So the foam roll is an excellent tool that many of us can purchase and have in our homes to help loosen up the spine. So what I want to go through is how we can do a little self-mobilization for that thoracic spine. So one mistake many people make is when they go to roll out their back, they will allow their lumbar spine to arch. So if you're going to roll on this foam roll and you're letting your low back arch too much, that will put those lower segments in extension, which is often a little bit painful, and you won't be able to really focus on your thoracic spine. So to correct that, you want to tighten your tummy muscles and tuck your hips underneath you and keep that tight while you're doing this activity. Now, the first thing you can do is keep your tummy tight, lift your hips up a little bit, and just roll that foam roll right along those thoracic segments. Sometimes you might get a little pop. As long as it's not painful, it's nothing to worry about, but pay attention to how your spine is responding and where the stiff segments are. And as you do this, feel where some of that stiffness is. To do a self-move on a specific segment, you can set your hips back down on the table, position that foam roll to a segment that feels stiff, and then just do a little back bend over it. And I'm going to emphasize again, do not allow your back to arch and then do a back bend, because you're just going to get discomfort at that lower lumbar area. Remember to keep the hips tucked underneath you. Find that stiff segment in that mid-thoracic spine and then just lean over it and come back up. This is a great tool to loosen up your mid-back and to help lengthen your spine after sitting for a long time. I hope this helps, and hopefully you come see us here at John Getz Physical Therapy if you have any other questions. Thanks.